Good evening, CPP families. Thank you so much for joining us tonight. It has been a while since we've had a town hall, and I've had some updates for you regarding changes to the New York State Department of Health guidance, and also just some updates from our school district. So I'm going to share my screen with you now and we'll get started. If you have questions, you'll find that there's a Q&A panel at the bottom of your screen. You can type a message into that box and our moderators will share that with our panel, and we'll be able to add your questions to the queue. If the question that you type in does disappear, please know that it means that it's been seen and that it's been recorded. I am going to walk us through our presentation first and take questions throughout the presentation. And tonight I have Jennifer Batzing, Assistant Superintendent for Elementary Education, and Linda Perry, Assistant Superintendent for Secondary Education, joining us this evening. And I have my two moderators here with us, Mr. Brian Kelly and Mr. Mike Simmons. So thank you to everyone for helping us this evening. Okay, give me 1 second to get us started here. All right, and as I said, thank you so much for joining us tonight for these updates. I'm going to go over a few things this evening. I'm going to go through the changes for isolation and quarantine. Those were released on January 14th, 2022. I'm going to talk about our at-home testing kits that come directly from the state to be distributed from families. And as timely as it is this evening, there has been some updates with masking in schools relative to a decision that was made in a Nassau County Supreme Court yesterday, and again in the court system today. So I will provide you with an update on that. And then as part of our snow day and delay notification, I have some updates with you on how you can get the most up-to-date information regarding snow days and delays. So just to go over some of the COVID strategies, prevention strategies that we have in place now. We have masking in place, we have 3 feet social distancing in place, we encourage hand washing. Our screening now is more in terms of when students come to school and they have symptoms, they may be sent to the nurse's office for screening. We are not going to continue to use the at-home screener, so you will no longer see that on the app beginning either tomorrow or beginning early next week. So that health screener from home will no longer be something that we use. I'm also going to provide you with some updates regarding tracing and testing and those strategies and how we're using those now. An update again on our test to stay strategy. We continue to have our cleaning and disinfecting strategies in place, and we'll be discussing our new at-home testing kit strategy. So some of the questions that we've been getting over the course of the last few weeks are, how do I report a positive case? So if you're using an at-home test that the state has provided us to distribute to all of you, families must report their at-home positive results directly to Steuben County Public Health Department. And we have the website here for you. You can upload your results to there. We also ask that you still notify the school of that positive result. If you're testing at school or with a physician, the school district or the physician will report that positive case. So you do not have to go to the Steuben County Public Health Department to upload that positive result. The state is then going to send a text message to the family with directions and next steps. So one of the most significant changes that we saw from the guidance on January 14th was regarding this reporting of positive cases. For the last, maybe 15 or 16 months, it's been up to the school district to report those positives. In this updated guidance, it's putting the onus on the families to report those positive cases, especially from an at-home case. From an at-home test case. So we are going to ask that you still let us know and that you upload that information. And if we do test you at school, again, we will make sure to let the state and the county know of that positive. Another change is that prior to this change in guidance, the school district would contact families and let them know that they were positive or they may have been a direct contact. In addition, you would get a follow-up call from the Steuben County Public Health Department. This change means that the state will actually be contacting you with a text message, and it'll go directly to the family with directions and what to do next. Another significant change is regarding direct contact notification. So in this updated guidance, families are now responsible for tracing and for notification of their direct contacts. So all individuals who are positive need to contact their direct contacts personally. The direct contacts can then go to Steuben County Public Health Department website to download their quarantine letter. Again, we ask that the direct contacts still notify the school so that we know that they have been identified as a direct contact. Again, it's a major shift, moving responsibility of the schools to notify from families to notify. And I'll use, just my family as an example. So if I was deemed positive, I tested positive on a kit, I would then let the people that I had been with prior to the 48 hours know that I was positive. I would then upload my positive to the Steuben County Public Health Department website, and I would download my quarantine order. And I would encourage my direct contacts to download their own quarantine letters as well from either the New York State website, Department of Health website, or from the Steuben County Public Health Department website. Another question that we've been getting is, what are the quarantine updates? So quarantine orders will now be written for 5 days based on symptom onset. So there are 2 changes just in that sentence alone. Prior to this January 14th guidance, quarantine orders were written for 10 days, and they were based on when you took your test. So now 2 changes. They're written for 5 days, and they're based on symptom onset. So 2 things for you to pay attention to there. Symptom onset is considered day 0, and then you would have your 5 days, and you would return to school or to work on day 6. 2 additional factors in terms of returning. Students and staff can return to school after day 5 if they do not have a fever and their symptoms are improving. What we've noticed over the last couple of weeks since this went into effect is that on day 6, some students and staff still are having symptoms and still feel pretty crummy. So they are not required to come back to school or work on day 6. It really has to do with whether or not you have a fever and whether or not your symptoms are improving. So if your child still has heavy symptoms, we do ask that you continue to keep them home. If you have questions about them, then please just contact our school nurses and they will help you walk through that process and help you determine whether it's all right for your students to come back to school after that day 5. Another question that we've been getting recently is where do I get a quarantine order? And as I've said, each individual needs to print off their own quarantine order from the Steuben County Public Health Department website or from the New York State Department of Health website. We will ask for a copy of the quarantine order before or on the day of return so that we have that and that we can help you determine a date to return back to school. The New York State Department of Health provided us with a really helpful chart, and it's quite small here. Once we publish this PowerPoint and this presentation and recording of tonight, there will be a place for you to print off the chart. And I'm going to try to break down the slides because there have been some significant changes for direct contacts in terms of when they can come back to school and when they can participate in extracurricular activities based on their vaccination status and their booster status. So I'm going to start with students that are age 12 and above, and walk you through the different categories that we have to walk students through and staff through to see when they can return to school. So bear with me as I talk through these with you. So if you are age 12 or older and you're fully vaccinated and boosted, there is no quarantine duration. You can remain in school as long as you're symptom-free. And you can attend after school activities. You can attend work, school, extracurriculars if you are fully vaccinated or boosted. Okay, the next category is if you are fully vaccinated and not yet eligible for the booster. So again, you would not have to quarantine if you have no symptoms. And you can attend work or school, and that's including travel to and from and extracurricular activities. So what does it mean to be not eligible for a booster? So there are a couple ways why you would not be eligible for a booster. One is that you've just had your second dose and you're not 2 weeks past that dose. It does depend on which type of shot that you got, how long you have to wait before you're eligible for your booster. So if it is Moderna, you need to wait 6 months before you're eligible for your booster. If you're with Pfizer, it's 5 months before you're eligible for your booster. And if you had a J&J shot, it is 2 months before you're eligible for your booster. There's one other way that you wouldn't be eligible, and that is if you've had COVID and you're in your 90-day window past your exposure. So that 90-day window does make you ineligible for the booster. So if you are fully vaccinated and eligible for the booster, but not yet boosted, and you are symptom-free, you can come to school if you participate in the test to stay protocol. However, there are no extracurriculars at that time. So you can come to school, but you cannot go to extracurriculars such as sporting events or clubs, drama, bands, those things after school. That's a significant change from the guidance prior to this January 14th release of information. In addition, if you're not fully vaccinated and you are not part of the test to stay protocol, then you do need to quarantine for the 5 days. All right, so no extracurriculars there either. In terms of testing, whichever comes first, at least 5 days after last exposure, testing is recommended, but it's optional. So if you wanted to send your child back to school on day 6 and felt that you would like to have them test at school before returning, we're happy to provide that test for you. And then if symptoms develop in someone who is symptom-free and has been boosted, that isolation period will start from symptom onset. And if there are no symptoms, then it would just be based on when you were notified that you were direct contact. So those cases are kind of tricky. As you can see, having this split out of these 4 different categories, it's challenging to remember the guidelines and the rules around each. So again, please reach out to the school district. We'll help you walk through those. The school nurses will help you walk through those to make sure that we can have as many of our students back in school as soon as possible, so that they're not missing out on their educational experience with us this year. I'm going to talk briefly about the age 5 to 11 age group. Again, this is for direct contacts who are symptom-free, whether it's for our students at the elementary 6th graders at that level. So if you're fully vaccinated, again, fully vaccinated, both shots, then there is no quarantine duration. And if they're fully vaccinated, they can travel to and from work, and they can participate in extracurricular activities. If they are not yet fully vaccinated, they have to quarantine for the 5 days or participate in our test to stay strategy at school. And again, that most significant change there is that there would be no extracurriculars at this time for those students. And I'm going to move into vaccination and booster requirements at this time. So fully vaccinated students, teachers, and staff who are exposed to COVID and must quarantine because they did not receive a CDC recommended booster when eligible can attend or work at school during the quarantine period where masking, distancing, etc. is monitored and enforced. Again, however, attendance at extracurriculars, after school, and community activities are not permitted. So Jen and Linda, I'm going to stop there and just see if there are any questions about quarantine, about where to report or how to find their quarantine orders.
Yes, just a couple, Michelle. The first one is, how can families determine who close contacts are at school, or how would we notify those contacts?
Right, that's a great question. And really one of the first questions that we all grappled with when this change in guidance came out. And really, it's important for families to know that in classrooms, our desks are 3 feet social distance. So you would not have close contacts in classrooms. Some locations that there could be close contacts are potentially in the cafeteria, maybe on the playground, but remember that on the playground and even in the cafeteria, you have to be within 3 feet for more than 15 minutes, and that's rare. I believe that that is why they made this change, is because the direct contacts and the spread of COVID was not happening in school. So I want families to know that you should just do the best that you can. We know that you won't be able to do this perfectly, just as we weren't able to do it perfectly when we were trying to determine what was happening in and out of school and on our campuses. So give yourself some grace when you're trying to figure out who your direct contacts are. We know that in school contacts did not cause spread of COVID. So it's really important for you to focus on who your children were with outside of school hours.
Okay, the next question is with regards to notifying school of a positive case. Are parents required to report a positive case with their student, or are they encouraged or asked to contact the school?
Great question. So the way we keep our families and our kids safe is that we know when we have a positive case and that they do follow the guidelines where they stay out of school for the 5 days and they return with no fever and with symptoms decreasing. So are you required to tell us? No, you're not. However, for us to offer home teaching for things that we're doing through virtual home teaching after school, we would need to know that it was based on a COVID positive test for us to offer that. And we would need to have that quarantine order for you to return so we know what date your child would be returning. Again, not a requirement, but a request from us so that we can offer that virtual home teaching after school for students, and so that we can continue to try to keep our school population safe.
Okay, can you review what does it mean to be the definition of being fully vaccinated?
Yeah, so right now the definition of fully vaccinated is just the 2-shot series for Moderna and Pfizer and the 1 shot for J&J. That is still the definition of fully vaccinated.
Is the school requiring proof of vaccination?
We are not. If we are informed that you have, that you're a direct contact or positive, then we can have our head nurse look in the system to see if a student or staff are fully vaccinated or not, and that determines return date, and that determines what activities a student can be part of.
Okay, there's a question about making sure that maybe we can share the links to the booster timeline that you referenced, because that was super helpful.
Absolutely. Yes, and we did send those home in a letter, but I will make sure that those go out in a family communication again this Friday from your building principals. They are all located in one place on the New York State Department of Health website, which is nice that you can go to one place and find these charts, and we'll make sure that you have that access no later than Friday this week.
Okay, Michelle, you shared that there would not be close contacts necessarily from classrooms because of the social distancing, but there have been some instances where students were notified that they were contacts. Will that not happen anymore?
Yes, so this change from the January 14th guidance is that school districts are no longer required to trace and to notify direct contacts. So we will continue to work with families as best we can. There are times when we know, for example, if we had a positive on an athletic team, we may know that other teammates were with that person, and we would let the team know that there was a positive on their team. So we'll continue to do those things, but at this time, the New York State Department of Health has asked that the transfer of contact tracing and notifying direct contacts has become a family responsibility instead of a school responsibility.
And while it's not required, should we let the nurse know our students' vaccination status?
They aren't able to keep track of that right now. It is entered into a system that nurses have access to when students and staff, actually anyone, when they get their vaccination status, they're entered into a system that our nurses do have access to. So they can look up that information. We love the family cooperation and their willingness to partner with us on that. It doesn't hurt to let the nurses know, but they do have access to that information if it becomes something that they need. And right now there is no vaccine mandate for schools. It is something that is offered to students ages 5 and up. And we'll continue to share out places that our families can get vaccinations. We'll continue to share out information where our families can have their children boosted when the time is right. We'll continue to share that information out, but it is not something that is required by New York State at this time. So Jen, I'm going to move on to the at-home testing kits from New York State for a few minutes, and then we'll go back to questions. So the governor's office and the New York State Department of Health have been providing school districts with at-home test kits to share with families for about 3 weeks now. And I kind of want to give you an update on how we're going to continue to get those kits out to families. As you know, we had 3 distribution dates when we first got the kits out, and we were able to get out about 1,800, almost 1,900 kits at that time to families. January 28th, this Friday, all elementary families who signed the consent form that went home with students on Monday can receive a test kit in their child's backpack. We know that some families will not want their children to take them home in their backpack. So, you know, that consent form will be important for this coming Friday. We also want to make sure that we can get your family's kits if you need them. They do not have to only be used on your individual student. If someone in your family is positive and you want to use those kits on the remaining people in your family, you can do that. On January 31st, all families can pick up an at-home kit between 3:30 and 5:30 at the high school. And it will be at the cafeteria theater entrance, also known as the Loop. In addition, families can contact their school principals if they need a kit outside of those times. So please, if you have symptoms or your student has symptoms, please feel free to call the school principal or the school nurse, and we'll make sure that we get kits home to you and your family. In addition, the nurses are going to send home kits with any students who test positive at school with their parents when they come to pick up. So we're going to continue to share these kits out. We're getting weekly shipments from New York State Education Department. So we do want to try to saturate our community with these tests. So please know that these are free and they are available to you. And we're going to continue to create opportunities where when you're at school, you're able to pick them up. We last week tried 2 new ways to distribute. At the end of the varsity basketball game last Wednesday, we had someone there that was handing out kits. At the end of the middle school concert last week, we also had the principal there handing out kits. So we're going to do our best to get these to you in the safest and the quickest way that we can over the next few weeks. Again, the links to these charts that I mentioned are here at this link. You'll have access to this. And again, we'll make sure that this gets out to all of you no later than Friday. This whole presentation will also be on our YouTube channel later this evening. So these slides will be available to you then as well. So these health changes with families being the center of the contacting their direct contacts and letting us know at school. We just need your support in keeping our schools safe. We do ask that you keep your children home if they have symptoms. Again, we'll make sure that we get kits to you if you need them. We ask that you notify the school nurse of a positive result in your household. And we're going to continue to work together to keep our students in school. And we've been able to do that safely this year. We'd like to continue that practice, even though the way tracing is being done has shifted as of the January 14th information. Any other questions, Jen, regarding quarantining at home kits, direct contacts?
Yes, just a couple. With regards to testing, are students required to test before returning to school?
They are not required to test. That is just something we will offer families if they would like to have that done.
Another question around, making those contacts to those direct contacts, should families be doing that through class tag, or should they ask a school for other parents' email addresses? What information can the district share to help us notify the contacts?
So I think it's important that families do make sure that they are focused on the direct contacts that they know of outside of school. That really needs to be the first layer of defense for that direct contacting. If families are sure about a student from school, you can give us a call and we'll help with that notification. If there's someone that isn't someone that you are familiar with as a family, we can help you work through that.
This one's about virtual home teaching. Who should we contact in order to get that set up for a quarantine student?
The school district, as soon as they are notified, they will reach out to the family to offer that virtual home teaching. So you'll get a call from someone at the school once we know that there's a positive result or a direct contact from school. So the school that your child attends, they will reach out to you with the offer of the virtual home teaching.
Okay. The next one, how will policies be adjusted if we see an increased number or outbreak at school?
Yeah. So right now, the New York State Department of Health does not have a, if you remember last year, so I'll take you back. If you remember last year, there was a system in place where it was red, orange, yellow, and green. And this school year, they did away with that system. So there isn't a threshold, like there has to be a certain percentage in Steuben County or Chemung County that says schools must move to remote. There are really two reasons why a school district at this point would go remote. One would be that there's like an uncontainable spread connected to school, which we have not seen in the last 20 months. And the second reason would be that if there were enough staff out of a specific building, that the building couldn't provide the education necessary or the services necessary to continue that day. I think if you remember, or if you think back, that happened just one time last year at the middle school in October. We haven't seen that yet. However, our teachers are working tirelessly to cover periods for each other so that that isn't something we have to do. It could be personnel even in food service. You know, we need to make sure that we have enough people providing food service for our students. So if that was the case at some point, that there weren't enough people to feed our students or to get them to school because of transportation and not enough drivers, things like that, those are really the only reasons at this point that we would move to virtual in regards to the pandemic.
That's it, Michelle. I think we're ready for the next question, which really should get at some of the other questions that are coming in about masking. So let's go there.
So once again, it's been a really rough 24 hours for school districts. We were informed late last night around 5 o'clock that Nassau County Supreme Court had determined that Governor Hochul's mask mandate was unlawful. A month prior to that, the Albany County Supreme Court had ruled that it was lawful. So within the last few weeks, we've had two county Supreme Courts share two different perspectives on masking in schools. What we immediately saw the next morning were families that are not in favor of mask wearing, you know, letting us know that their students would not be wearing a mask to school. In the meantime, we heard from the New York State Education Department that masking was still required. And for school districts, the New York State Education Department is our governing body. In addition, the New York State Department of Health put out communication this morning confirming that right now that mask wearing was still indeed a mandate. I believe that the governor appealed the decision in Nassau County. They were in court most of today, and at 4:57 this evening, the statement that you see here on this screen from Commissioner Betty Rosa is that the court did grant a stay in mask case. And what that means is that the appellate division granted the application of the Department of Health and the governor's office, and that they are going to keep the masking mandate in place until they get this worked out at the court level. So this stay is in place, to my knowledge, right now through Friday. And we will continue to work with our families regarding keeping them updated regarding the mask wearing. So right now there's a stay order in place that the masking mandate remains in effect for schools across the state. So we're going to continue to follow that masking update until we hear differently from the governor's office, from the Department of Health, from New York State Education Department. That's where we are with masking. I don't have any further updates on that other than what I received this evening at 4:57 p.m. but my commitment to families is to keep you updated on where this is every day as we hear more and as it changes. And then I am going to switch to some just school updates. We've been hearing that there's been a little bit of problems with the user experience with our Stay Connected app. We are working on those difficulties. For me, I always get the push notifications, and at the last time we used the Stay Connected app, I didn't get the push notification. So I do know that there's some difficulties in that push notification right now. So we are adding a new system. And actually it's not a new system, but a new layer of communication for families. We are going to send an email to our families on snow day, for snow days and for 2-hour delays. We are not just going to send the email to the primary email address, but we will send it to the primary and the secondary email address that's listed in Parent Portal. And that will just be an additional communication. And we're going to keep our other sources in place. Like we're still going to use WENY and WETM to report. The information will still go on the CPP website and on our Facebook pages. And I know we have some great people running those parent pages for the middle school and high school. They are always good at getting that information out there as well. So we are going to add that email communication. I know that that is not a phone call home or a text message at this point, but it is an added layer that we can add to help with that. For our 2022-2023 school year, we are looking at new communication systems that will offer families choices, where you can choose whether you'd like a phone call, a text message, an email. And so we'd like to offer that. But for the remainder of this year, we are going to add that email communication out for families. Again, not just primary email address, but primary and secondary email address. It is looking like it's going to be rather cold, potentially later this week, and we want to make sure that we can try this system out to see if that helps families, if there's a need to look at a 2-hour delay later this week. So I want to thank you all for coming tonight and for continuing to support our students. I know that the last 24 hours has been difficult for our families to navigate when information comes in and it feels as if something's changing and it's not changing, and our students keep getting sent these mixed messages, and we'd like to stay as consistent as we can for them. Jen, I'll give one more opportunity for any questions before we sign off tonight.
Yes, it looks like we have 2 questions remaining. One, if masks were not mandated, would there be a virtual option for families with high-risk members?
So we aren't, we're going to continue to work with families on those virtual options, especially those with medical needs. We have not offered a virtual option this school year. As you know, the New York State Department of Health and the New York State Education Department have not encouraged virtual options for families, knowing that students learn best and well when they're in school and with their teachers on a daily basis. So we're going to do everything we can to keep our students in school and with our teachers every day, 5 days a week. So we'll continue to work with families with medical needs on the needs for virtual options through our normal policies regarding home teaching needs.
We have one more question and then we'll close up here, but it's winter sniffle and runny nose time. So if a child has a minor symptom like that, which may not be COVID at all, do they have to take a test and be negative result before they can come to school?
Right, great question. So it's still really important, even if there's a sniffle, for you to contact your school's nurse, because they do have a set of questions that they go through to ask families about specific symptoms. And if it's one set of symptoms, students are able to come to school. If it's another set of symptoms, then we will ask them to test either over here at the board building, which we're using Craig Partners right now to offer that. Or if they're at school with the symptoms, then the nurse can test them there.
Okay, and then Michelle, just to reiterate, if anybody has any questions about the virtual home teaching services, to be sure to contact their building administrator and we'd be happy to help.
Absolutely. As always, if you have more questions after tonight's presentation, please feel free to always write to me at ask@cppmail.com. You can always contact your building administrators. We appreciate your partnership. We work hard to keep our students safely in school, and you have all been part of the reason we've been able to do that. I'd like to keep our partnership strong as we manage these next few months. Thank you all for attending tonight. And again, please reach out if you have any questions. Thank you.